So why is spinal decompression sometimes necessary? Well, to give you a little anatomy 101 of how the spine and the disc work, we have our spine here, okay? So I'm gonna come a little closer so you can see what it's like. So your spine has your spinal cord that goes right back here. You have disc, bone, and disc. There's a hole here called the intervertebral foramen, the IVF, where the spinal nerve comes out and comes through. Well, that spinal nerve is supported, and that hole, the IVF, is supported by the disc, all right? So as long as the disc is nice and full, well, your body and your spine should be functioning perfectly. But what happens is sometimes injuries, specific ailments that you may have, maybe you've dove into a pool head first, okay? Maybe you parachuted out of a plane and landed feet first, like some of our military service members. Or maybe, you were a pilot and you've sat down and maybe have been injected a couple times out of the plane. Well, what happens is that force, injuries and accidents over time can cause the disc to collapse. Whether it's something that was done repetitively, maybe you had a job where you were required to sit down on a tractor all day for 5, 8, 10 hours a day. And through that, the disc starts to collapse. And now I'm going to show you another disc where this one has collapsed. And when you look at the two, they look completely different. There's this one right here where it's normal, and this one here that's collapsed. And as it collapses, you'll see where the disc can pinch a nerve as the IVF starts to close down. And when that happens, now this nerve is no longer happy. You may start getting a pain shooting down the leg or shooting down the arm. And with that, through the x-rays that we'll be able to see and the exams that we'll do, I'll be able to find out and figure out whether or not if yours is here, which is nice and great and perfect, or if it's here, where the disc started to collapse. And if I see the collapse and the compression, that's where I may recommend something called spinal decompression, where you're laying down and you're being tractioned. And as your spine gets decompressed, it opens up this joint. It creates a negative vacuum within the joint and opens that back up to give the nerve some relief here so that the pain starts to decrease over time. Well, a lot of people will ask me, well, Dr. Tam, does it ever just come back? Well, it depends. It depends. It depends on how bad it is. And it also depends on how good you are with some of the treatments and some exercises that you're supposed to do, right? If you ever want to have for me to look at to see if you have an ailment where spinal decompression and traction can actually help you through your pain, give our office a call. I'll sit down with you. We'll take you through an exam. We may take some x-rays from the side and some from the front to see what the problem really is. Is it just a misalignment problem, or is it also a spinal compression problem? We'll sit down with you, go over your results, and then we'll go from there. All right? Hope you've learned a lot about why we do spinal decompression or why spinal decompression may be necessary for some people. Have a great day.